Hi, good evening. So, welcome to the Hugh Baird College Health and Social Care and Nursing Open event. So, this evening we're going to run through a few different things for you to listen to and find out about the courses in health and social care that we offer. So, first we have Karl Jones, who is the clinical lead in Knowsley Resources for the NHS. We have a couple of videos to show you about the environment that we teach in. And then we also are going to talk about the further education courses that we offer in college. Then we have Stella joining us, who's going to talk about the higher education courses. And we also get to hear about one of our past students, Molly. And then we'll give you some time for any questions that you might wish to ask. So first, I'm going to invite Karl to join us. Hi,
Evening,
Karl.
everyone. Hi, Tina. Evening, everyone.
So first thing I'm going to ask Karl is about your journey in the NHS and how you became to be the job that you are now, the clinical lead for learning disabilities.
Yeah, of course. Well, when I was a lot younger, I think I've been working with people with learning disabilities since I was 16 as a support worker. While I was in college, started working and ended up going down an MVQ route while I was there. So college weren't really for me at the time. But when I'd gone, I know you're going to kill me for saying that, Tina. But I just found a job which I was really passionate about and went through an MVQ route. That didn't really help me when I went into uni, though, to be fair, because I'd been that far out of academics. I found that really difficult. Found that there was a learning disability nursing course in university and did my 3 years there. From there, I've done quite a wide variety of jobs, and not all of them have been learning disability focused. So, my first job was in the Walton Centre, which is a neuro hospital, as a staff nurse in there, where I'd learned quite a lot of physical health clinical skills. So it was a lot of tracheostomy care, catheter care, IVs. It was very physical health focused. So I was in there for about a year. And I decided to want to kind of move on and expand my experience. From there, I went into children's inpatient CAMS. So that was mental health ward for children. And I was there for about a year and a half. Really enjoyed it there. It was care planning, mental health care for kids with either learning disabilities, autism, or mental health difficulties. Following that, I decided to want to get back to my roots and go into back into learning disabilities. So I went in for a Band 5 job in the community learning disability team. And absolutely adored the job. Absolutely adored the job. It was right up my street. I was a Band 5 for about 2 years, and then I'd got a job in an autism service within a similar team, and that was developing training packages around autism and upskilling our mental health colleagues around working with people with autism who don't have a learning disability. I'd also looked at kind of setting up some processes within adult mental health services to ensure that people with autism get equal access to healthcare as everybody else. Following on from that, I went back into the learning disability team as a Band 6 for a short while. And that was just holding a bit more of a complex caseload. And the stuff that we do in community is looking at getting equal access to healthcare. We do mental health monitoring. We do behaviour support plans.
Karl, I can't quite hear you. So what we might do is go to the video first, and we will come back to Karl in a minute. We'll see if we can get him back on screen for you. My name is Tina Blees and I'm a Health and Social Care Lecturer at Hugh Baird College. Within St Winifred's campus, we have 6 different classrooms, 3 upstairs, 3 downstairs. Alongside a library, they have a Costa. Learners quite often like to do some research and work together in groups in the space that they've got available. Where we are now is the clinical room. That's embedded into our lessons as much as we can. We come in and we set up real life scenarios, maybe in care homes, maybe in a hospital setting. We use all the different equipment. So you're getting to deal with real life situations and how you would react, but then getting feedback on it to improve it as well.
My name's Olivia. I am studying Health and Social Care at St Winifred's campus in Hugh Baird College. Studying at this campus is such a great opportunity. It's a converted church, which you wouldn't think to look at. It's got all the features of clinical skills and as well as teaching skills, and it's just got everything that you need there. I've worked in health and social care for 3 years now, since I was 17. So I've always wanted to do health and care for people.
My name's Chloe Winterson. I'm currently studying health and social care in Hugh Baird College. At St Winifred's campus, I enjoyed the space that we've got. We're very lucky to benefit from state-of-the-art facilities.
Hugh Baird College has given me the platform that I need to succeed and be the paramedic that I want to be.
Hugh Baird College has got really strong links with Merseycare. They have Life Rooms, which is next door to the Health Training Hub. They provide CPD courses to our learners. They also provide placements on mental health wards and in community roles. Our ultimate goal for students is that they come into our course, they learn the valuable skills, the knowledge that they need to progress onto the careers that they want. We want you to be successful, we want you to be in an amazing career, in an amazing sector with them values and skill sets alongside you. Hi everyone, so I'm just going to give you an overview of some of the qualifications that we offer. So we do have a 14 to 16 department, so you could start your health and social care journey there. From year 10, year 11, the health and social care department deliver the 14 to 16 qualifications. You can then progress straight to the FE courses, or you can apply direct from school, which is great. So we have access for both options. So we have a level 1 qualification and you get to choose options on level 1. We have different options available for anyone who wishes to study health. What is great about it, so you could choose childcare alongside health and social care, and you would study 1 lesson a week for each option. And then in January, you would then choose which option you prefer, and you would then study that lesson more often in the week. So you'd go from 1 lesson to 2 lessons a week alongside your GCSE qualifications. Now, we also offer a level 2. That is a full year course, and you would have 4 health and social care lessons a week, and you would also study a GCSE alongside it. So that could be maths or English. The level 2 programme, you would study 7 different units over the course of the year. Topics such as safeguarding, equality and diversity, human growth and development. And you would also get the benefit of 20 days placement. And your 20 days placement could be in any type of care setting. We try to make sure that we get somewhere that you really, really want to be in. So you can then take the theory that you've learned in lessons and you can put them into a placement. Then we have a level 3 qualification, and that is a 2-year programme. It's the extended diploma level 3 in health and social care. Now, during that programme, it is quite intensive, so you have to write an awful lot of assignments, but most of our students really enjoy it, and we'll hear from Molly later, and that's the course that Molly has studied. So we do safeguarding, human growth and development, but we also do psychology, sociology. And then in the second year, we do topics such as mental health, anatomy and physiology, public health, loads of exciting topics. And what it does is it gives you an overview of the whole health and social care area. So we can make sure that we cover different aspects so it's suited to every type of setting that you might want to progress into. So universities, they appreciate your wealth of knowledge because you've studied so many different topics. During the level 3 extended diploma, you would do 60 days placement a year. So that's quite an extensive placement that you would have to complete. And once you get to second year, we give you some support in writing your UCAS personal statements. And that placement that's when it's crucial, because you get to write all the different things that you've learned about from your placement and take it into the UCAS statement, take it on into university. Now, we also offer some T-level programs. I don't know if anyone's ever heard of T-levels before. They are brand new, and they are the up-and-coming vocational qualifications. We are the only college in Merseyside at the moment that are able to deliver T-levels. We have 2 different routes. We have the T-level health, and then we have the T-level healthcare science. So 2 different routes where you get to participate in a T-level. The lessons are quite different for T-level. So it's 70% theory and 30% practical. And the idea is that T-levels have been written by employers in the sector, and they've been combined all their knowledge and produced the courses for yourselves to study. So it's almost like a nurse cadet program. So we learn things like how to write care plans, how to do risk assessments. One of your exams is how to write a care plan, which is very unusual for a health and social care course. So we're really excited about them. We also deliver a scientific element alongside the T-levels. So it's embedded into your timetable, and you would study science twice a week. And what that does is it gives you the knowledge of how different things work inside health and social care that are more scientific, such as infection control processes, how X-ray machines work. You might learn about different radio waves and different aspects of science, but it's all contextualized and embedded into the health and social care timetable, which our learners so far who have been doing it since September are really enjoying the program and the courses that we're offering. So next, I think we've got Karl back on now, so I think we could go back to Karl.
Hi, sorry about that. Got kicked off. I'm not sure where we got up to in terms of my journey through the NHS. Where did you hear up to, Tina?
So you were talking about your progression onto being a band 6 and the support that you're providing then to other practitioners.
Yeah, so yeah, we in terms of community learning disability nursing, we offer like a wide range of support. It's hard to kind of summarize what it is that we do, because we do a little bit of everything in terms of the community. But that's what I really enjoy. It's something completely different coming in every day. I was band 6 in the team for quite a short period of time before progressing into my current role, which is the clinical lead role within the team. Now I kind of have clinical oversight as to what's happening. I provide all the clinical supervision to the staff, and I've kind of develop all the pathways and make sure that we're delivering high quality care within the team. So that's kind of a brief overview of how I've gotten to where I've gotten to now. I think in terms of education prior to it, I think that the courses I really wish I had a course like what's being offered in Hugh Baird moving on into the thing, because it academically it would have really prepared me for university. But it's not just that, it's also the skills around that risk assessing care plan and things like that, which you can develop in these courses, which are just absolutely vital within as you progress into a nursing role as well. Yeah, so I don't know whether you want to open it up to, I'm quite happy to just answer any questions people have got, or if anybody's got any, you want to put them through to me, T?
Yeah, okay. So I've got one question. So the opportunities that you've had and the pathways that you've gone down, is there any opportunity for other directions that you could have taken if you wanted to?
Yeah, I think we quite often hear as a learning disability nurse, why are you doing that? Because we're unheard of, really, learning disability nurses. We're we're kind of, people say, oh, there's no jobs out there, but as I've kind of proved within my career, I've gone out and been able to do kind of any other roles. I've been basically adult general nursing, neuro nursing, very physical health. I could go into any of the mental health wards. And I think it's one thing that you learn from working people with learning disabilities is how to be quite adaptable and transfer your skills and kind of think on the spot and think outside the box and look at that kind of whole picture, that holistic picture when providing care. There's people go on to do kind of commissioning roles as well. You can do, assessors for learning disabilities. I actually have done a course so I can now diagnose autism as well. You can go on to do a dual train. You can go on to learn the therapies, do training and courses in CBT, cognitive behavioural therapies, dialectical behavioural therapies, and you can deliver them within your service as well. You can go on to CQC. You can do kind of branch out into most areas. The person who I've just kind of taken over has gone on to become like quality matron through for a wide variety of services, about 16 services. So there's definitely loads of scope for progression and just branching out into loads of different areas within the NHS as well. And obviously you can look to go private, and there's some people who've set up like respite residential services, that you have nurses over, supported living services, for some decent supported living services as well. So yeah, you can branch out into many different roles.
Yeah. So I've got another question for you that's come through. So any advice for those looking to get into a career in the sector?
Yeah, I'd say getting some experience can be quite important. So whether that's either part-time, just getting some of that care, I'd advise people to go on some of these academic courses. It'll put you in good stead for getting into university. So if you're looking at kind of health and social care within college, that's going to put you in really, really good stead as well, as if you can get some of that experience and you get that feel and that vibe as to whether it's for you or not. So yeah, I'd definitely recommend getting some of that experience, getting on some of the courses, and start kind of familiarising yourself with the ethos of care which we've got within the NHS. Yeah.
That's great, thank you. So our brand new T-level qualifications offer 45 days placement, and that's in a clinical setting as well. But alongside the theory in the classroom of writing a care plan and the practice of doing it, would you advise someone to do a course like that?
Definitely. Like I said, in university, I really struggled with the academic side, and as you kind of, even in university, as you're going through that stuff around kind of care planning and stuff, you see all the theory of it, but actually getting that practical thing of sitting down and doing it is it's a bit of a different experience, because you've really got to work on that out the box thinking as well. So I think it's definitely worth it.
Got another question. So what's your favourite part of your job?
Favorite part of my job? I love seeing the patient. I love seeing my patients. Absolutely love seeing my patients. There's people who I still see now who've I've known for years and years and years, or there's people who I've worked with in children's services who've come up to adult services, and I'm still working with them, and just being able to offer that support and that help to them and make their lives a little bit easier. I think I quite like working with people who are in crisis as well, who are really kind of struggling and helping people to help support people to come through that and empower them to look after themselves and manage their own emotional needs as well. I think that's seeing that kind of achievements or helping people through that, it just makes you feel good about going into work.
Yeah. Another question. So what do you think the future of the sector is in terms of careers and opportunities?
Honestly, we're just branching out into absolutely everything. But I think, to be fair, at the moment, and I think now's a good time to be getting into it. Because when I qualified, even just like band 5 in community, it was like gold dust, and now like we're just absolutely struggling to even recruit in. So there's a massive gap in it. There's a massive gap. There's not enough people going through and training into nursing, so there's plenty of opportunities going in there, and I think. It's not just necessarily that ward work as well, because when people think about nursing, it is just a lot of people think about being on a ward, being on either a mental health ward or physical health ward, doing all that shift work, 12-hour days. It's not all like that, and there's a big shift into moving into community and for caring for people within the community. So a lot of your jobs might end up being 9 to 5, so you keep your weekends to yourself as well. But yeah, no, it's just constantly evolving and growing, and I think. I think that there's lots of scope for developing services and new services coming out.
Okay. If there was another job that you could have trained in, or if you were to change your direction a little bit, is that easy to do in health and social care?
Possibly, yeah. A lot of people, like I've had some people we've got a nurse within our team who's actually looking at dual training in psychology. We have people have a complete change of career as they go through, but a lot of people tend to stay within health if they found the right kind of role for them. If I was to go for any other role, I would think it was either a choice between nursing and paramedics, but I'm glad I stuck to my nursing anyway.
Can you see the question on the screen?
Oh, what is a common pathway that you would take if you study mental health? So a lot of people who in my university, they'd gone from school, gone into college and had it in the mind that they were going in, they wanted to do kind of health and social care and go into nursing. So they had that quite clear pathway going in, which was the easiest way for them to get into university. Actually, it gave them a lot more kinds of points to get in over those who took a less traditional route like myself. So yeah, I'd definitely recommend getting some of that experience and getting yourselves on a health and social care course prior to getting into university. I think it'll stand you in really, really good stead, especially if there's some of that practical experience that you can get. Yeah. And it also prepares yourself emotionally for what you're going into as well. Because I mean, as much as everybody, most people who we work with, and including myself, absolutely love the work. It can have quite a high emotional demand, and you do need to kind of get yourself prepared for that. But the emotional demand that's there, it just pays out tenfold in rewards, really.
Yeah. So in terms of the emotional support that you've talked about or preparation for the emotional side of the job, do you get enough support?
Yeah, definitely. I think we speak like in terms of our team particularly, we often just pull together and support each other, but there's lots of avenues, particularly in the NHS, where you can access support through occupational health. We have a lot of people, if they are feeling quite low, they can access talking therapies, they can access counselling as well, but we tend to, in health, just to kind of rally around each other and make sure we're all okay. And if we can take a little bit of a load off somebody, then we will. If they're not feeling so good that week. So yeah, there's plenty of support, and you've just got to. It just recommend people to open up and talk to your colleagues about it. It's really, really useful in get myself through the week sometimes.
Oh, well, thanks very much for your time, Karl. I know that you've got loads to do this evening as well. So thank you very much for spending some time with us.
Oh, no worries. And thanks very much for listening to me waffle on. Right, yeah.
So we talked a little bit about some of the courses that we've got on offer in health and social care, but what we didn't talk about was the progression from that. So in terms of the courses that we offer, you can progress internally from 14 to 16 or from level 1, level 2, and straight onto level 3 or TLevels, depending on what your route is that you would like to go on. So our level 2 qualification actually qualifies you to work in the sector. So you could complete the level 2 and then go straight into a job as a healthcare assistant or a support worker. Or then you could progress internally onto our level 3 qualification, or indeed one of our TLevels. So once you're on a level 3 or a TLevel, you get to do different types of placement. So our level 3s would offer community placements, and our TLevels would offer more clinical placements. And what we're doing there is preparing you ready for the world that Karl's just talked about. So health and social care in general, all the different things in the sector that are open to you once you progress and you go through the different qualifications and the courses. So our level 3 is an ideal route for social work. For example, you would progress onto university and become a social worker, or any other practitioner within the sector. If you really wanted to be a nurse, our T-level nursing pathway is the most suitable qualification. Mental health nursing, like Karl's talked about earlier on, that would be our T-level health qualification. And then in the second year, you could choose mental health nursing as your option. If you like the idea of being a diagnostic radiographer and it's a little bit more scientific, the role that you're looking at, then you would be looking at the T-level healthcare science route. Now, you can do any of them options and they would all get you enough UCAS points to progress into university. What we also offer is a level 2 qualification for anyone over the ages of 19. And the opportunity there is to study health and social care 4 lessons a week, but also increase your grades in maths or English and resit a qualification in your GCSE. Alongside that, you would do 20 days a week, 20 days placement minimum over the full year. But then that gives you some experience and it gives you a health and social care qualification that will enable you to then progress into our HE department as well. Now, from level 3, T-level or level 2 are mature classes. The opportunity to progress into the HE is wide open for you. So we have an automatic progression route straight there for you. And we invite the lecturers from our HE department to come over and talk to you about them. We also have Stella with us this evening. So I'm going to invite Stella to come and talk about her courses. Sorry, Stella, you're on mute.
Thank you. Okay, so thanks a lot, Tina. Okay, so I've come to talk to you tonight about the higher education courses that we offer at Hugh Baird. So for those of you that don't know, higher education is degree level courses. So before you can go on to the degree, you would need to have a level 3 qualification in a relevant subject. So the access to higher education is a level 3 qualification that we offer for anyone that's 19 or over. So if you don't have the traditional qualifications like that Tina was talking about, then an access course is a possible for you. Okay, so we offer 4 pathways at Hugh Baird: nursing and midwifery, allied health professions, social care professions, and social science. So depending on what your career route, your career goal that you've got, you would choose one of those pathways. So our career progression in terms of health and social care is really, really wide that we can offer. So adult or child nursing, midwifery, mental health nursing or learning disability nursing, social work, probation services, youth work, or psychotherapy even. There's lots and lots of areas that you can go into with our access course. So the access course that we offer will enable you to go on to a degree programme at any university. So if you are considering moving out of the area, any university would accept the access course, but it's also enables you to come onto internal progression onto our HE programs that we offer at Hugh Baird. Okay, so just in terms of entry requirements for an access course, you have to have your GCSEs, English and maths in place, and some relevant work experience. Now, the reason we ask for the work experience is because it's about progression into university, and the universities want to know that you can do the job. You understand the job role that you're going into, and we give you the academic qualifications to help you be successful at university. That's what an access course is all about, the academic skills to be successful at university level study. Okay, so Access is a one-year programme. It's a 34 teaching weeks, and it is equivalent to 3 A-levels with a range of assessment methods. So it is quite an intense course, but it does get you where you want to go if you've got a very clear profession in mind, a career goal. It will get you onto that degree. It will not only get you onto your degree, it will give you the skills, the academic skills that you need to be successful while on that degree programme. So if you wanted to stay with us at Hugh Baird College, our university centre offers a range of degree programmes that you could progress onto. So in our Faculty of Health and Education, we have 4 foundation degrees that would be suitable for working in the health and social care sector. So we have a foundation degree in health and social care. We've got a foundation degree in mental health and wellbeing. We also have a foundation degree in children, young peoples and their services, and a foundation degree in health, nutrition and physical activity. So depending on the career goal that you've got, one of those degrees could support you into that job role. If you do the foundation degree, which is up to a level 5 qualification, you can stay on at the university centre and do what we call a top up to a full honours degree. That's a level 6 qualification. And our level 6 provision is in children's schools and families, and our BSc in health and social care. So any of those 4 foundation degrees would enable you to progress onto one of our top up degrees. And all our degrees are accredited by the University of Central Lancashire. So, you know, they are really embedded within sort of practice as well. Most of those degrees will have a placement element. So you would be out in the workplace and you'd be bringing the theory that you learn from on your degree programs out into the workplace. And you also would do a placement portfolio, which supports that sort of application of theory into the job role. So career opportunities from our degree programs, it really depends on what you're interested in terms of social care and health services. So if you wanted to work in the health and social care sector, residential community services, if you had career goals working in clinical settings, such as a healthcare assistant, care worker or support worker, our foundation degrees would support you into that in health and social care. Working at a level 5 qualification as well, you would be able to go into senior support and management roles within the health and social care. So if that was something you were interested in, those degree programs would support you with that. Our mental health and wellbeing degree is very much focused in on the mental health services. So if you were interested to be a support worker within mental health, a youth worker, or working in counselling, or perhaps rehabilitation and recovery support network support worker roles, would really that degree would support you in that. Our health, nutrition and physical activity degree is very much focused on things around public health, so supporting the health and well-being of local communities. So community health workers, food workers, sports and exercise or nutritionists would all you'd be able to go into that role through those degrees. So if you don't have a level 3 qualification and you are interested in one of our degrees, we also offer what is called a year 0 entry year. So a year 0 entry year is for someone who maybe doesn't not have the traditional qualifications, and they have a lot of work experience out in the sector. So it would support you into that degree level studies. It would be equivalent to a level 3. But it is a year 0 would enable you just to stay within our degree programs. You'd be signing up for the foundation degree, but coming in at a year 0 entry year. Whereas the access course is also a level 3 qualification, but that enables you to go to various universities within the local sector or the local area or further afield. So I think that's all I've got for the degree programs that we offer. So if we go back to Tina, I think Tina's going to just finish up tonight with some extra information about with the previous students. Okay, thanks, Tina.
Thanks very much, Paula. So now I would like to introduce Molly. Molly is one of our previous students who's just completed their qualification with us. So let's see if we can ask Molly some questions about being a student in Hugh Baird College.
Hi.
Hi, Molly. How are you?
I'm fine, thanks. How are you?
I'm great, thank you. So thank you for joining us this evening. I've just got a couple of questions that I'd like to ask you. So what is it like being a student at Hugh Baird College?
Well, from personal experience, I really did enjoy doing the course here, not only because like it's so rewarding, but there's always like 24/7 support whenever you need it, and I feel like that's just such an important thing when you're on such a high in demand course that you need lots of help on, because it can be challenging as sometimes, but it is really rewarding and it is really enjoyable as well.
That's great to hear. So can you tell us what your favourite topic was that we studied?
Oh God, I've got a few. Yeah. Do you know what? I did like safeguarding, and I know there's more complex things and there's more, like, it's interesting in itself and there is more interesting courses, but it's because you just use it so much. Like in any job you go into, no matter if it's like a care work job or anything, you're going to use safeguarding a lot in your day-to-day life, and it's important to have that knowledge. So I just found it really interesting and enjoyable to know how I can use this knowledge and interact it into my day-to-day life. And
placement, Molly, how did you find placement? Where was it, and did you enjoy it?
I loved my placement. So I done my placement in a local care home just round the corner from mine, and we just done so many different things, like assisting with feeds, like helping them with their movements, keeping the brain engagement going by playing games, puzzles, taking them for walks. At even one point, I remember I showed you, I was dressed as an ice cream lady, just pushing ice cream, just making it a bit more enjoyable. And as I said, like previously, it is just so rewarding, because just knowing you've done that little thing, it does, makes you feel a bit better that you made someone else's day that bit better as well.
I remember the photographs well.
Yeah.
So what do you think of the environment in Hugh Baird College that you learn in?
It's just really positive. Like, I can't really put a fault on it, to be honest. Like, I was never a morning where I woke up and was like, oh, I can't be bothered going to college right now. It's just so draining. I was always just interested and happy to just go in and then, just be like, oh, what am I going to learn today? Or what's today going to have on the agenda? Like, it was always just a really positive and, friendly atmosphere that just made you want to learn more and it engaged you a lot more.
That's lovely to hear. And what other additional things did you get to learn? Things that weren't in the qualification, but extra skills?
I want to say communication and confidence, but I know communication links into healthcare as well. But my confidence skills and honestly, yeah, my communication skills. Because before I started this course on college, I was so shy. I had no confidence whatsoever. And then as soon as you just go into it, you meet these new people and you get taught how to use different forms of communication. And I don't know, like going into especially the care home and standing up and doing group tasks, engaging more and doing more practical work, like your confidence just grows so much more. And I feel like that's always an important skill to have.
It is, you're absolutely right. And here you are on a live event.
I
know. So what about your lessons themselves? How were they? Were they boring lessons, note taken? You tell me.
Obviously different lessons range from others, because you've got some lessons where you are just taking notes, but obviously it's important to take notes to help you further along with your assignments, which I learned. But like all lessons, you get some lessons where you're like, oh, because you obviously have like you know, more units that you're more interested in the others, but it's all a part of the course, so you have to just keep an open mind with it. But as far as lessons go, if I ever had a problem, I was always speak to who my teacher was and say, listen, I'm not really engaging in this, or I'm not really understanding this as the way we can incorporate more practical work or more theory work, or, you know, just engaging as a group. Because me personally, I understand and taking information better when I'm active and I'm doing it rather than note taking. And if I ever had a problem with that, it was always changed for me. So can't fault it.
That's good to hear. So what about interactive lessons as well? Did you have more lessons where there was different technologies being used? I'm thinking of the clinic and the simulation suite and things like that.
Yeah, definitely. We had many lessons in the clinic. And again, like this, I found the clinic really, you know, fun and interesting. And I was so engaged in the clinic because we learned things, you know, like basic first aid, CPR, patient observations, like stuff that would also help you in your placement. But again, in day-to-day life, you don't know when you're going to need to use first aid or CPR, and just getting that knowledge to help you. And then like the clinic is such, like, it's just so nice for the college to offer something like that, because I know not most colleges offer like an in-clinic in the college, and I feel like we were quite lucky to have that, to have all of, you know, the equipment and that there for us to actually use and practice on instead of just learning about it.
Yeah, no, that's great. Thanks very much, Molly. So if you were to give any advice to a student that's listening to us now, what would that be?
Don't be nervous. Don't listen to everything that you've heard today and think, oh, this sounds like, you know, you hear all these big words and you're like, oh, this sounds like a really demanding course and really, you know, higher up there, and I don't think I can do this. You can do it, because I definitely thought that when I was applying for level 3 health and social care. I thought, am I going to be able to do this? And then, you know, I came out fine, absolutely fine, you know, getting into uni and stuff like this and getting the grades I need. And there's always help if you're feeling, you know, a bit, you know, let down or, you know, a bit set back and stuff. There's always 24/7 around the clock, as you probably know, Tina, me messaging you at like 11 at night asking for help. Tina will always help you. All the other teachers will always help you.
So I have another question. How long have you wanted to work in the health and social care sector?
I forever. Like I've always been that kind of person who's quite, you know, caring and cares a lot for other people's, you know, physical and emotional well-being. And I've always wanted to incorporate that into my career in the future, which is what hopefully I'm going to do. I don't know. It is just a very rewarding thing to do. And I can't even give you a time, Tina. I've always just wanted to help people.
No, that's amazing. It's in your blood.
It is.
So what is next for you? What's your next step?
So currently I am doing training for a ward assistant role in Aintree Hospital, which I don't think I would have done if I didn't do health and social care, because I would not have had a clue how to do it. And hopefully, you know, just work for a few years, get a bit more experience on my back, and eventually apply for uni to go and do midwifery, go and do a midwifery degree and, you know, deliver babies.
Sounds amazing, Molly. So In terms of students who are worried about whether health and social care is for them, could you give them some advice on how they would choose this sector over another sector, maybe IT or art and design?
I would say just, have a look around and speak to people who have done the course in the past, and, go around and experience different things. Try and maybe volunteer. Volunteer in, I don't know, on a ward, in a care home. See if you can volunteer. Obviously, if you're of age, it's a bit harder if you're not 18. But I mean, it's I understand it's harder to get a bit more knowledge behind it, because obviously you can't be old enough for all different volunteering roles. But honestly, I'd just say, go and try and get some experience in different things and see what you enjoy more. Try and weigh up the different scenarios. Do I want to help people, or do I want to sit and do IT? Do you know what I mean, Tina? I can't put it into words.
I know exactly what you mean. So next we're going to open it up to any questions that we might have from the audience. So I've got a question here. Do you need to start at level 1, or can you start a course at level 2 or 3? Yes, so you can start a course at any level in health and social care, and the way that we determine it is what you want to get out of the course, and also your grades that you might be coming to others with. So if, for example, you're going on to the T-level program, we would be asking for grade 4s in English, maths and science. Now, the level 3, we would be looking for grade 4s in English and maths, and then a level 2, if maybe you've had a bad day on the day of the exams and you've got a 3, then we would be looking at level 2, so we can support you to get your maths and English alongside it, and then you can progress on to the level 3. So you don't necessarily have to start at level 1. You can go straight in at T-levels or level 3. Next question. If we wanted to do level 3, could we start? Sorry, I didn't quite get to see that. Do I need to have any studies, any specific subjects to get onto any of the health and social care courses? No, the biggest requirement that we have is maths and English, and that's because that's part of your progression. So like Stella was talking about before, where you need that ability to progress on, we're exactly the same. So to apply for university, you need to have maths and English to be able to get into university. So we need to make sure that you've got them skills ready to progress on. Molly, I don't know whether you can see that question. So how did you find making friends at the college?
Really easy, especially you just go there, everyone's so friendly, and especially because everyone on my course, obviously I was on level 3 health and social care. Everyone there has it in them to care for people and to be friendly. When I first started, I was like, how am I going to speak to people? And you know what? People just come up to you and speak to you. No one cares. Everyone just wants to make sure that you're all just there having a nice time, enjoying the course. And, no one's left out. So you won't ever have a problem making friends, especially because all the lessons are very engaged and there's open communication with everyone. There's no time to be shy.
Okay, so question there about age limits to apply for the over 19s course. You need to be 19 to join an access program, but there is no upper limit on that at all. So, we've got the full age range on our access courses. I think one of our oldest was 54. So, you're never too late in life to change careers. So it's a really good course for adults. It just depends on where you come from, what your background is, and whether or not you are, just upskilling in terms of your job role, or if you're actually going into a completely new career. So no age limit at all. You just need to be 19 at the start of the course. Anything over that is great.
Is health, social care and nursing studied on an individual campus? If so, how far is it from the main Balliol campus? Good question. So health and social care is studied in our St. Winifred's campus, which is a beautifully restored building that we have, and it is just for health and social care. It's a 10-minute walk from the Balliol building to the St Winifred's campus, and it is a beautiful building. So we do use the whole of the building for all the lessons, and that's where our clinical room is as well.
Okay, so there's a question about an access course there, that they're really hard, and do people complete them okay whilst juggling young families? Obviously, as adults, we do understand that we've got life commitments outside of college, whether that's children or, you know, caring responsibilities. The course itself is 2 full days a week, so 2 days, 9 till 5. But then you would obviously be doing your work, maybe having to work alongside that, and also your care and commitments. So it can be quite intense, because it is it's a 1-year course, and it does pack a lot into 1 year. But we do actually give you, we do a complete unit on study skills. So time management and how to prioritize your workload is a key aspect of what we do. The curriculum, the way it's designed, enables you to go in with introductory units, and then we build on those integrated units from 3 credits up to 6 credit units at the end. So by the time you get to those bigger independent projects that you need to do, you've really developed the skills in terms of your time management, but also your academic skills. So it's really, really supportive the way we've implemented the course. So
another question, how do I apply for a course? So there will be a link, or the link is on the screen now, which you could use to apply for the course as soon as you wanted to. Can I choose my modules in further education or higher education courses? So our modules for further education are part of the qualification, so they are already set. In terms of our T-level qualification, you do have an option to choose in the 2nd year of the T-level health, whether you'd like to study nursing or mental health nursing. So that is where you get to choose which direction you would like to go in.
Okay, and so for our access courses, depending on which pathway you want, those modules are set for the access. So you would choose your pathway based on the career that you wanted to go into. For the foundation degree, those modules are set, but when you get to the BSc in health and social care, there is an optional pathway there, depending if you've come from health and social care or a mental health pathway. There is an option that you can take at the BSc level.
Another good question, where have past students gone on to? So our last year, our level 2 students over the age of 19, we had 100% progression to our own university centre. So they all enrolled on Stella's qualifications as well, which is lovely to see, because I still get to see them in the same building and say hello. Our level 2 younger students, 16 to 19, they all progressed onto a level 3 qualification, and one of our classes progressed into employment. So they all chose to go into healthcare assistants or support worker job roles. And our level 3 extended diploma students from last year, 98% of them progressed straight into university, and 2% have gone into employment.
So a question what interested me in studying health and social care. I went to an opening event. Don't know if you remember seeing me, anyone. So I went there, and I just heard all about the course, and I heard just, you know, all the interesting different things you can do going into placements, getting experience, like, you know, the percentage rate of going straight into university or an access course, just all the different things that can reward you, and how much it is such a great stepping stone into getting into higher education and just starting you off in life. So I was just really interested, because I knew that's what I wanted to do. And if this is an easier, you know, helpful route for me to do, I'm going to take it.
So that's it for this evening. Thanks very much for joining, and we hope that we've answered any of your questions. Applications are open for both HG and FE courses, so please feel free to go on the website and complete your applications. Thanks very much.
Thanks.
Thanks, Molly.
Bye.